Our next session is talking about opportunities. And we're looking at really what's the trend? Where are we going? What are the top, not just the trend, that's probably the wrong word, right? But we're looking at the data, we're looking at the facts. And we're really fortunate to work with Frost & Sullivan for them to bring us this great market report to share with you. And it's a really unique opportunity for us to be able to share this kind of stuff. So I'm going to introduce you to Daniel Ruper from Frost & Sullivan. He's the Global Research Director. Please read his bio in the agenda book. Fun fact, Daniel currently has on 2 wearable tracker devices. And if you can guess which these are, you will win a free Frost & Sullivan research report. They're kind of pricey, so it's a good one, of your choosing from their connected healthcare team. He'll take your guesses at the end of the talk.
Thanks very much, Jill. And thank you very much for letting me be here with all of you this year at the Digital Health Summit. And if nobody can answer that question, I actually may put that out on Twitter. So hopefully somebody can be able to answer such a question as which 2 devices these are. But I'm doing that for a specific reason. I manage a program that we call at Frost & Sullivan Connected Health, which is one of 3 areas that we work in with our clients in healthcare, the others being life sciences and advanced medical technologies. But it's really for us an interesting area of the space, and we help our global client base on solving a lot of different types of business problems and to drive their businesses forward, not only in terms of growth, but what we call traveling on a path to visionary innovation. And so what I'm going to be talking about here today in regards to digital health are some sort of key questions that we get, which are actually applicable to most types of markets that people are trying to understand from a business perspective. However, within the context of digital health, you run into different other challenges, especially in terms of the definition of this market and what it means, or especially in terms of the business model question and who pays for things. This is also, of course, a question that everybody is constantly asking on this space. So these are sort of 4 key themes that I'm going to be discussing here with you this morning. So as we all move through this cycle of life, we have the opportunity to interact with healthcare in various ways. It's sort of a mix of in-person health solutions, or, as I continue to change this term, connected health solutions, virtual solutions, those enabled by technology. And hopefully, as we sort of move through that journey, you have the opportunity to not only choose how you're going to receive your healthcare or interact with the system, but this also will continue to change. And what technologies that you will utilize will also continue to change and move back and forth, even as you progress through your life and what you're trying to use and have in terms of your experience in healthcare. And the other interesting point about this is the data. So the data also has to be able to work concentrically within the context of all these different markets or sort of areas of healthcare shown here. And that's an important challenge that everybody is continuing to try to solve within the whole discussion around the digital health space and what that can mean to sort of driving forth more progressive aspects of healthcare transformation in the future. So first, I'm going to go through some things around the market. This, of course, is a key point of questions and discussions that we have with everyone and clients around the globe. And sort of digital health, this here is a sort of a quote talking about the lexicon from Paul Sunye, but I view this sort of market as a convergence area of opportunity that is coming about because of the merging of interest between the information communication technology space and healthcare. So hopefully that sort of definition solved this sort of question for everyone, but probably has not. But you sort of see that a whole variety of markets, even those that were in existence before and some that were important ones from the health IT sector, are merging with all sorts of other new markets that are coming to be within the context of this term called digital health. And this is something that will continue to, of course, evolve, but this area overall, with all these different terms of what we're talking about in terms of existing or new opportunities, are very important in terms of what we're talking about in healthcare. And so at Frost, we talk a lot about opportunities because of major aspects of industry convergence. So this sort of diagram here shows that across some major vertical markets. healthcare, information technology, automotive, chemicals, and energy. And so I've sort of mapped the digital health space here, and you can see that a lot of the different points of technology that we talk about in this area, even in the context of moving to the automotive use of different things, such as what was shown here at last Digital Health Summit with the launch of WellDoc's Blue Star in terms of partnership with Ford. There's a lot of new things that are coming to be because of different areas and the way that companies are exploring opportunities in this space. When you sort of move to something that's more healthcare focused, these are some of the main markets that we talk about within this space overall from a healthcare specific standpoint from segmentation. Health IT, video telemedicine, remote monitoring, which here is a large bucketed term of a lot of different markets, and mobile health. I've thrown wearables up here also from a standpoint within how this merges with all these markets. But really the lines are blurring across these spaces that were once divided in the past. And that's an important thing to remember within as people are dealing with new product development or designing their businesses as well as coming up with their strategies. I mean, the blurring of the line between what goes on in video telemedicine and mobile health, the blurring of the line between new product launches and expectations within remote monitoring and mobile health. So these types of things will continue to progress, but again, there's a lot of new opportunities because of how these markets are merging in some regard in the marketplace. So here to show something that's more of a growth market. So we heard this morning or yesterday about patient engagement, and that's an important term. It's also an important buzzword right now, as well as our others like population health or other things. But that's sort of creating opportunities for growth in terms of different sectors. So this showing the growth in terms of projections from our evaluation at the end of the year on the patient portal market for hospital and physicians. And I think from a compound growth rate standpoint, this is one that's even sort of higher than a lot of other comparative markets that I'm going to be showing in this presentation. But it goes to the point that in order to achieve patient engagement, you have to have different types of tools and platforms in order to be able to enable that type of secure communication between the physician and the patient. And this is an area which can be a path to hopefully enabling those types of things to occur from a concept standpoint. So that's a growth market. There's also mature markets. So this is showing the cardiac monitoring services space. And this is, compared to a lot of other areas, is in essence a mature market. And some of these subsegments within cardiac monitoring services are actually in decline. But there are areas of growth within this. And the reason I show this is for a couple of reasons. So event monitoring is a growth area within cardiac monitoring services. That's actually something that gets tied into even things that we know about more visibly in digital health, for example. That's something that a LiveCourse product can be utilized in regards to event monitoring. This is also an area where, for example, recently Medtronic made an acquisition of a company called Corventis. And we see a lot of interest from companies in the medical device and the medical technology space in areas that tie into things that are supporting readmission prevention or better opportunities to support disease management in the home, especially for the cardiac conditions. And since Medtronic's acquisition of Cardiocom, we've seen a lot of interest from their peers in trying to understand not only the remote monitoring space, but as well as this aspect of cardiac monitoring services, as they're trying to drive their portfolios out of the hospital and more in terms of new opportunity sets for them, especially within the context of the home. So here are a few different things: remote monitoring versus video versus PERS. And these are three areas that we talk a lot about in terms of having some of the highest sort of business opportunities in this sort of space in what I would say is the next 5 to 10 years. And it's for a lot of different reasons, but when people talk to us about these markets, they also vary widely in terms of their current revenue standing within the context of telehealth. So I'll show some interesting information later in terms of the opportunities for remote patient monitoring. But if you look at these sort of three sectors, it's the lowest of these from a revenue perspective right now. But video telemedicine is also something in which I think has a lot of opportunity, especially in the next decade, as that can continue to progress, even in terms of how we look to experience healthcare, even in our home, to supplement our own need for a primary care visit or other things. But personal emergency response systems, so this, because of the standpoint of that actually having a business model which is driven a lot, even on direct consumer payment. It's something which sort of dwarfs other markets right now in this sort of remote monitoring or telehealth space because of that and the revenue that comes from that type of business model. But I'll go into some other points around business models in a few more slides, but I just wanted to show this sort of comparison here because it's an important one. So customer, here, this is some test data we did with consumers trying to answer some questions around wearables. And sort of what you see is not everybody uses a wearable all the time, but most people probably use them occasionally. And what we found in this, in terms of even this test, is there was a statistical difference between men and women in terms of wearing them from a frequency standpoint. I don't know if that has to do with the fact that there's sort of a fashion gap right now in the wearable space for women. I know that even myself, with a guy I know who used to do a lot of car racing, was excited one day when he came to me and said, "Hey, are you wearing a tire bracelet?" But I told him, "No, I'm not wearing a tire bracelet, I'm wearing an activity tracker." So that's sort of the thing that probably people don't want to do when they're going out for the evening, is say, "Hey, I like your tire bracelet you're wearing with your dress." But these sort of things will continue to, of course, be improved, and I think you saw some of that at CES even, for those of who were there. But sort of age is a difference in terms of the utilization or of these devices. We even see differences in terms of where the people live, where you see higher rates of use or likelihood to use for people in an urban environment versus suburban or rural. Or even we've seen other things, I didn't show it here in terms of data, where for those who have higher levels of identified multiple chronic conditions, they have likelihood to be able to want to start to use an activity tracker this year as part of their health data. And I think that's an important point, which I didn't include, but it goes to the importance that people are trying to leverage technology now as part of understanding not only themselves in healthcare. And that's a concept that I think is important. You see from other types of survey work from all sorts of folks in the market, or even people having interests in their health record or a personal health record or other things. But that's sort of the interest that's also driving the digital health space overall. So reasons that people stop using. So a lot of people stop using. I think even in terms of folks talking here, mention of certain devices ending up in drawers and nobody's using them anymore. I know I don't use mine all the time. I do it for specific reasons. So here's showing some sort of statements of why people stop using a tracker. Losing commitment to your diet or fitness plan. That's probably a key one, and it was sort of here. But we did see a sort of difference even in this sample that we could rate between men and women again, where for the women respondents, it was that lost commitment to the diet or fitness plan. And for the men, it was entering the data manually was too tiring. So I don't know if sort of that's a data point that men are lazy in terms of the utilization of these trackers or what that means. I know that I always don't like entering my data manually if I'm trying to use the application that ties to the tracker. Although, like if you watch, I think the videos on Azumio's site from the launch of Argus in their application, they have this interesting thing where the phone is actually able to, take a shot of the meal that the person's eating and uploading that nutritional information right into the phone. I think that's the type of thing, or as we talk about not having to deal with the manual entry of data in mobile health, that will help with some of these issues, but it's sort of a challenge from a technology standpoint right now. I know if my phone could enter my meals, I would actually use that more frequently. So what is the value of this consumer-generated data? And this is sort of actually from our work at American Telemedicine Association recently and surveying folks there. But so this is what is the view of the use of consumer-generated data with the provider-generated data in the EHR. And people in general see this sort of having high value from a data set, but I think the conversation will continue to go on in terms of how do you use that data in effective decision making. But it's definitely something, when you look at the major vendors, they're trying to pull this consumer generated data directly into the EHRs for those EHR vendors. They're working and trying to enable those things to occur, or even the remote monitoring companies and having the same data that the patient is using in their home from their more consumer devices pulled through into the same dashboard that they're using with the other parts in their daily remote management of that patient. So in essence, people have, I think, good hopes for this consumer-generated data and how it can be used in the context of normal types of enterprise healthcare data. So now to business model. Here are sort of 6 big themes from healthcare, but I think all of them tie into the questions around how do you design effective business models in the digital health space. And that has to do with the modernizing of care delivery. I think that's an important one. Role of new participants. This is also an important one, even from, of course, announcements of how Apple, Samsung, Google, Amazon, or other types of major stakeholders like this, and what will be their play and position in healthcare moving forward. The rethinking of the customer, that will continue to change, as well as the expectations of those customers. And that ties next into the question of who pays. This is an important one, as it varies widely depending on what market you're actually talking about, as well as the mix of who will pay for different types of solutions potentially. Companies, of course, are revamping their strategies in the marketplace, and as ones, like I mentioned, even in terms of some of those acquisitions, trying to realign their portfolios to continue to be a part of this sector as legacy sectors in healthcare try to continue to move towards maturation. And new partnerships, this is really, I think, an important concept in the digital health space, as well as the building of ecosystem creation. I think, of course, that's why you've had good success in leadership from Qualcomm Life, for example, in terms of building of the ecosystem. But partnerships really are an important part of this because of those convergence opportunities across healthcare and ICT. And really, new products often wouldn't able to be launched without such partnerships. So this here is sort of a mapping of a business model from mobile PERS, from research we're about to put out on the PERS space. But what I'm actually showing here is more that between Everthere Mobile PERS, which really goes to the partnership standpoint that I just mentioned. So that wouldn't be possible without the partnership between AT&T and Numera, who's the device manufacturer for that mobile PERS device. And this sort of shows a lot of different questions out there that relates to what I mentioned in terms of business models. So who are your customers in terms of your targeting for this solution? In this case, it's directly to healthcare enterprises. And what they're doing with that is they're targeting that sort of contract and referrals aspect of the PERS market. And there's really 2 sales channels to this market via that, referrals, as well as direct to consumer. So they're really not trying to deal with, they're looking for that full B2B play as the way to reach that type of consumer. But there's another point I think here is very interesting and is an important one. A lot of these types of different solutions in digital health is that monthly fee. So there's a lot of stuff that gets bundled into that monthly fee, and that's something that really has to be looked at because there is a price threshold from a floor standpoint in order to actually have a viable business in this area. And that only relates not only to how much stuff you can put into that fee, but also in terms of the scalability of these types of solutions or the need for scalability in order to have viable business models take place in the digital health arena. And so why did I show this example here of this recent product launch of AT&T is because of the fact that the telcos continue to increase in their stakeholder importance in healthcare. They will continue to drive this for different reasons, but what I'm showing on the outer rim is one point that's because of this. So the outer rim of this sort of spectrum of their portfolios shows the traditional ICT vertical market opportunities that they have, those traditional telecom services, unified communications, regular cloud services, broadband, all these types of things that they sell across industries, financial services, healthcare, and others. And this was really the inroad that a lot of them tried to build on in terms of what their opportunities would be in healthcare. So as you move further within this type of spectrum, shows some of the other types of product solutions that the telecoms are trying to launch in terms of the healthcare space. And those become far more specialized. And they need to deal with that from a partnership standpoint. They often do with that from trying to set up reselling, or they are actually an integrator of other people's services. I mean, that's how they will sell video telemedicine endpoints, for example. So we also see, I think, a lot of interest from the telcos across regions is they want to understand what is going on here, what are people trying in the United States, what is going on in Europe, what is going on in Latin America, that people can be successful. It's not like all these companies are successful, and it's not like either that the majority of Verizon or AT&T's revenue in healthcare is actually coming from these specialized healthcare markets, is not at this time. but it's something that they hope to achieve and grow, because we know that they, like those two examples I just gave, healthcare is of a critical importance for them as a focus industry moving forward. So the future. So here are some other points from a recent thing that we did at ATA, but it also ties into what we've talked about in our own more formal business assessments of different aspects of market opportunities in this landscape. So this shows highest impact of healthcare of people from our work at ATA in the next 5 years. And home health, disease management, remote patient monitoring, that's what I showed, which is the smallest of those three comparative markets right now. At the beginning, is the leading one. And this is what we've also set out in the market, actually probably consistently for the last 2 years in terms of the broader telehealth landscape. Video telemedicine, I think this is an important area of telehealth as well, and that also came back from people in terms of us asking these questions at ATA. Mobile health applications, this is of course a crazy hype space right now. There's a lot of questions, how do you get value, all sorts of other things, but it's an important area that people are trying to design effective pathways for growth for their businesses. Telemental health, that's actually another one that we've been asking and talking different questions about, but it's something that people see having a high level of transformative potential in healthcare, is the use of telemedicine services for mental health. And so when we sort of move to talking about longer term, here's some other similar data that we just did again. So home disease management, remote patient monitoring, video telemedicine, leading two markets with greatest growth opportunity within the next decade. So there's a lot of other ones that fall, and people were only able to choose one in terms of this question, but I think it goes pretty consistently in terms of the views of the market right now. And there's a lot of different reasons for that. I think I even talked with Jonathan Linkus from ATA recently in an interview about that there's, because of the changes in healthcare right now, what people are trying to do in terms of moving away from fee-for-service, as well as the focus in terms of 14 and 15 on specific diseases within the context of readmissions, you're seeing a lot of interest in the remote monitoring space right now, from not only people trying to leverage this technology, as well as the vendors trying to create or take or understand what opportunities that they can have in that exact space. And so I'll sort of show again the three markets I showed at the beginning in terms of the revenue opportunity, and then sort of this again, how that breaks out. And it's not that something that as maybe mundane as the personal emergency response systems area is not something that people don't see as a good area of growth opportunity. I think it is. It has probably a 10% CAGR within the next 5 years, for example, in terms of growth. But I just wanted to highlight these three, as I think these are sort of three key areas in the broader telehealth landscape that have some amount of good importance among all sorts of variety of different markets out there in the landscape. So I'll go back to the overall landscape itself. So these are mostly focused on application markets, as well as our map sort of in terms of where that customer focus is for the end market, as well as where it comes from in our view from an industry standpoint. So that's where I talk about at the beginning, where digital health really is residing at a nexus of opportunities because of the converging of traditional or legacy markets of information communication technologies and healthcare, which were really having a lot of aspects of separation, but are now coming together. And hopefully that'll create new types of opportunities, center points for innovation, and in the end, will show the importance of digital health overall in healthcare as we move forward into the future. So with that, I could take any sort of questions, or if anybody can answer this question, then they can. Yeah, go ahead. It is a jawbone and a misfit. All right, that was the guess.
Okay, who else is gonna?
Yeah, come up and see me after that. Go ahead.
So this is just a difficult question because I hate the term mHealth, Matthew Hall from Health 2.0. But given that American Well says that about 80 to 90% of its visits are using iOS or Android, how do you distinguish between telemedicine and mHealth applications? And is that a useful distinction? And will you join me in my quest to abandon the term mHealth and change it to something useful? That's the last part was a comment. I'll give you that, but also a question.
No, I think that's an interesting question. I think that goes back to the problems in lexicon in the space in terms of mobile health or telemedicine or video telemedicine, as in reality the use of those especially in the way different companies position or American Well as one example, is within the utilization of Android or iOS on the smartphone. So in that sort of use case, what you're really talking about is that mobile health use, but it goes to really all these types of things are merging, and I think at some point we have to sort of solve that issue from a lexicon standpoint, but I think that sort of drives some of the confusion in digital health, connected health, mobile health. Yep. Yep. Thank you, Joe.